We next meet Ramona over 4.5 years later on April 15th. She is now 45. She is seen by Dr. Brian Lamont, Dr. Elroy's partner in their private OBGYN practice. He conducts a D&C for a spontaneous abortion. In his pelvic exam, he notices a mass that might be a fibroid, but the ultrasound is negative. He orders a CT scan, which reveals a 9-centimeter pelvic mass. A few days later, on April 20th, Dr. Lamont admits Ramona to the hospital. During the laparotomy, he removes a packing sponge, which was apparently left inside during her C-section more than 4.5 years ago. He notes a large resolved abscess in the cul-de-sac with approximately 18 inches of disintegrating packing material. The sponge is located within a cystic mass. After Dr. Lamont incises it, he notices a large amount of greenish fluid that escapes. He places a Jackson Pratt drain and completes the procedure without complications. He notes that multiple sponge and needle counts used throughout this procedure are correct. Dr. Lamont orders a pathology exam on the specimens removed during the procedure. Dr. Harvey Jameson, the hospital's pathologist, conducts the exam and writes his report. Click Images Results Reports to read Dr. Lamont's operative report and Dr. Jameson's pathology report. Did the retained foreign body cause an adverse clinical outcome for this patient? If so, what would the potential value of that adverse outcome be? Answer the question in the space below and click Submit. Here are other viewpoints.
Yes, the retained foreign body caused a large resolved abscess that required a surgical procedure on April 20th. In order to determine damages, we would have to review the patient's symptoms and/or loss of function during the intervening 4.5 years. The total damages would include the cost of the surgical procedure and all follow-up care, any economic loss related to the time she was functionally impaired by the foreign body, and a to-be-determined valuation of the non-economic damage of pain and suffering.